because he obviously has an ear infection. Why won't people just give him an antibiotic and let the poor guy stop suffering? And she looks at me like I'm the devil. She looks at me like I'm a terrible person who wants this poor 80-year-old guy to suffer. Hey, good morning. How you doing, guys? My name is Boris. I'm a physician assistant working in urgent care medicine. And I just want to tell a very quick patient story that illustrates why sometimes you should not just give somebody an antibiotic and hope that it fixes all their problems, like a lot of people think that it will. So here's what happened. My nurse tells me there's an 80-year-old guy. He's had an earache for about 10 days now. It's not getting any better. He went to his primary doctor. They just put him on Tylenol. They refused to give him an antibiotic. Those terrible people. And then he went back and there was a wait, so he came here to us at urgent care instead, hoping that we'll just give him an antibiotic and that his pain will just go away because he obviously has an ear infection. Why won't people just give him an antibiotic and let the poor guy stop suffering, because that's obviously what he needs. And so my nurse tells me this and I tell her, well, maybe I will, maybe I won't. We'll see, I'll have to evaluate him. And she looks at me like I'm the devil. She looks at me like I'm a terrible person who wants this poor 80-year-old guy to suffer. Because obviously that's why I'm in medicine, right? Because I want people to suffer? Or maybe it's the opposite. I don't know. Probably the opposite. Anyway, so I finally get in there. The guy's well appearing, no acute distress. Vital signs are within normal limits, no fever. He looks well. I pull on his ears, there's no pain. I start looking in his ears. Right ear, totally fine. Left ear, full of wax, complete cerumen impaction, soft wax, and there's no pain with palpation of the pinna, of the tragus. There's no swelling or palpation of the mastoid. I don't think that there's anything real serious going on, and I don't think that it's swimmer's ear. I don't think it's an outer ear infection. However, I cannot tell that it's not a middle ear infection because I can't see the tympanic membrane. So now I have two choices. Do what the patient and do what my nurse tell me to do, which is just to throw an antibiotic at him and hope that it's a middle ear infection and hope that that makes it go away and the poor guy can stop suffering, and that's it. Be a good person, right? Or I can keep digging a little bit further and do a ear lavage, have my nurse do the cerumen impaction removal, get the earwax out of there and really see what we're looking at, see if he really does have an ear infection or if there happens to be something else possibly going on. So of course I went with the second option. We do the irrigation and they get all the wax out. It doesn't really cause him any pain. He doesn't get dizzy. And I look at the tympanic membrane and it's not red, it's not bulgy, it's not swollen. There is no middle ear infection on the left side causing his pain. However, I ask him, how do you feel after the earwax was removed? And he goes, oh, actually much better. And I ask him, is your hearing better? He says, yes, I hear well now. I hear like I usually do. I ask him, do you have any pain now? What's your pain level, scale of 1 to 10? He goes, 0. I feel much better. And so at the end of the day, it was this really big earwax impaction, maybe getting wet, maybe getting swollen, for whatever reason, just pushing on his extra auditory canal, and also even more than that, probably just the negative pressure causing pressure on his eardrum to cause that sharp pain. So we remove the wax, he feels completely better, there's no infection, we don't need to put him on antibiotics, which all have side effects, of course. So if I don't have to use them, I don't want to. And so we remove the earwax just as a diagnostic thing to see if he even has a middle ear infection. And as soon as we remove the earwax, his symptoms are gone. No antibiotic needed. Now, if I just kick the can down the road like everybody wanted me to and gave him amoxicillin and hope it goes away and boom, get out of there, yeah, my patient interaction would have been quicker. My numbers would have been a little bit better, I guess, but I wouldn't have solved the guy's problem. And now we solved this problem. No antibiotic needed. The guy goes on his merry way and everything is better. So the moral of the story, guys, is don't just throw antibiotics at it, even though that's what everybody wants you to do. Dig a little bit further, use some critical thinking, do the right thing. And sometimes, yeah, you will end up needing to prescribe an antibiotic, but sometimes you won't. You're the provider. It's your decision and your responsibility to do what's best for the patient. All right, guys, hope you enjoyed that short story. See you in the next video.